Almost half of unfilled NHS consultant posts in Scotland have remained vacant for the last 6 months. Figures just published by health boards also show a 15% rise in the number of vacant nursing and midwifery posts over the last year. Doctors and nursing unions say it's having an impact on patient care. The Scottish Government says record numbers of people are now working for the NHS. Here's our health correspondent, Lisa Summers.
It's in areas like the Highlands that the challenge of recruitment is most acute. 9% of consultant posts here are unfilled, 6% of nursing and midwifery roles.
So hi Caelan, thanks for coming to see me again today.
In Shetland, paediatric orthopaedic surgeon Simon Barker has travelled from Aberdeen to provide a visiting clinic. It makes a huge difference to his patients to have the doctor come to them.
It was really stressful having to go to Aberdeen. We used to have to go every week, and it put a lot of strain on me and on Caelan when he was little.
Try and stretch that foot, you know, that naughty foot there.
Across Scotland, 180 consultant posts were still vacant after 6 months. Simon Barker says that puts additional pressure on doctors.
We have a worsening crisis of longer-term vacancies in consultants across Scotland, and that's a very big concern because it leaves a huge amount of pressure on the clinicians who are remaining in that department to maintain the service.
At the other end of the country, they're having recruitment problems of their own.
I worked in the hospital here and it was really difficult to try and get doctors to come and work. And the GPs, there's hardly any GPs left.
They can't seem to get the doctors that want to come here. You know, I don't know if it's because Stranraer's such a small place.
Good afternoon, Hinge practice, Joanne speaking.
This local GP practice has been advertising for 6 months. They've not had one response. Now it's to be taken over by the health board.
Most of us, unfortunately, are getting towards retirement age, and there are very few GPs who will still be GPs in 10 years' time.
The government points to record levels of training places and says 1,000 new staff have been taken on by the NHS last year alone. But the Health Secretary, Shona Robison, says even then the government is working to fill vacant posts.
We're working with networks across more than one hospital, for example, to help those rural general hospitals to sometimes recruit to posts that are more difficult to fill if they were standalone posts. And of course we've brought in things like recruitment bonuses for GPs in harder to fill areas.
But nursing unions say the recruitment crisis is having an effect on patient care.
Nurses come out every day trying to do a good job to look after the most vulnerable people in our society, and if they're telling us that they don't have the resources to do the job to the best of their ability, then we should listen to that.
Today's figures are a gauge of the pressures on NHS staff. A workforce plan for the future is due in the spring.
Well, let's join Lisa in Edinburgh. Now, Lisa, these figures on recruitment weren't the only ones released today.
Well, that's right. Health boards regularly publish statistics to paint a picture of how the NHS is performing at any given time. So we saw the latest staffing level statistics today, but also something else that's very much been in the public domain, access for children and young people to mental health counselling. And we saw a slight increase in the number of people that were referred to counsellors within the 18-week targets. But overall, since the government set that target, it hasn't been met. And there were considerable variations up and down the country. And when you look at the bigger picture of how the NHS is performing, the government will tell you that it's doing a lot of groundwork to try to change the way that staff and services operate. In fact, how we all integrate with the NHS, and interact with the NHS, I should say. But I think when you look at the general trend for now, we're seeing an NHS that is increasingly stretched.
Lisa, thank you very much.